We started looking in the last lecture at the axes around the ankle joint and foot and subtalar joint. And now we're going to talk a little bit about the muscles that drive the motion. But I think one of the things that we have to look at and always keep in the back of our minds is what are the actions of the muscles and how do the muscles function. And those may be two very different things. So today we're going to talk a little bit about the muscle actions, and these are the things that are primarily open chain related. So open chain plantar flexion occurs when the foot wants to come down. And again, when we're looking at it from an open chain perspective, and I always kind of like to equate this to what's happening in space when gravity's not involved. And these muscles are responsible in the posterior capsule compartment are the ones that are responsible for plantar flexion. So the biggest plantar flexor is this gastroc, the Gastrocnemius. And we can see its attachment, its origin on the medial and the medial and lateral femoral condyles. And it's a bipinnate muscle, so we have a nice intermuscular septum that comes down, and it blends with the Achilles tendon, where it will insert into the superior aspect of the calcaneus, again via the Achilles tendon. And we have multiple muscles that attach to the Achilles tendon. The Gastrocnemius and the Soleus. We'll talk about the Soleus here in a second. The gastroc is innervated by the tibial nerve. And again, it is responsible for plantar flexion at the ankle and knee flexion at the knee. But let's look at something, and this is to kind of store in your brains for a couple of modules from now. And that is, let's look at this orientation of the origin. And the origin is we have the two heads that attach medial and lateral. So if I have a longitudinal axis coming through the femur, then I can see that I'm going to have a big rotary component of the medial and the lateral head. So while our textbooks don't really describe rotation of the gastroc as a function of the gastroc, as we start to learn when we look at things on Earth as opposed to out in space, and we have ground reaction forces going through the foot as our foot hits the ground, and we stimulate a rotary component all the way up the entire lower chain, and we'll look at that in a couple of weeks, we can see that there is going to be a contribution of rotation from the gastroc to the femur. And if the femur connects to the hip, then our gastroc has a direct influence on hip rotation as well. Kind of interesting to look at that and say, wow, I never put those two together. But let's keep that in mind. So I wanted to start today just looking at what our muscles do in space, open chain, and then in a couple of weeks when we get to gait, we'll start saying, oh, all right, maybe we have a little bit different function of the muscle. So our function may be a little bit different than the action. So another little muscle that we need to just mention is this plantaris. And this plantaris runs right along. It's a small muscle that runs right along from the lateral femoral condyle and inserts into the calcaneus, and it's just a very small muscle belly with a big long tendon. oftentimes on dissection, that tendon gets confused as a nerve because it's such a long tendon, and not everybody even has this muscle. And I think its primary role, although when we look at again in space, we call it a plantar flexor and a knee flexor. Again, look at the orientation of those fibers. It probably has a significant role in rotation, but because of its size and the orientation and the length of its tendon, it's probably a sensory organ more than it is a primary mover. So we're probably stimulating this muscle as our foot hits the ground and our knee gets lengthened, our knee gets straightened, it gets a little bit stretched. It's probably providing a large neurological input to our brain and saying, hey, our foot just hit the ground, I'm starting to get lengthened, you better start getting ready because I got a lot of things that's going to happen in a very short period of time. So Plantaris, don't think so much about what it does in terms of a primary mover. Think more along the way that it's probably a big sensory input, big sensory organ that provides a bunch of information back to our brain. Now, if I fade out this gastroc and take a look a little bit deeper, we can see again our long tendinous attachment of the plantaris, and then we can look deeper to that and see the soleus. So the soleus is a little bit purer in terms of its plantar flexion function and its attachment into the Achilles, and its origin is on the posterior surface of and the head of the upper third of the fibular shaft and the medial region of the posterior tibia. So this is a pretty big, wide muscle. It inserts into the posterior surface of the calcaneus. Like I said, it's one of those muscles that combine with the Achilles tendon. And while again in space, it's a plantar flexor, as we'll learn in a couple of weeks, it's also very, very important during gait, during function, as a knee extender. So again, let's just kind of keep that one and floating around in your heads a little bit. And it's like, it doesn't even cross the knee. How can it impact knee extension? But it helps to decrease or slow down the rate of tibial advancement and allows the upper body to continue over the top of the knee, allowing it to go straight. So it has a big influence in function on the knee, but in terms of its non-gravity function, it's a plantar flexor. So the flexor hallucis longus is a nice long tendon that comes down and attaches into the distal phalanx of the hallux and crosses right under the sustentaculum tali, that aspect of the calcaneus, which acts as a fulcrum for it, and originates from the muscle on the posterior surface of the fibula and the interosseous membrane, innervated by the tibial nerve, as well as part of the peroneal branch. Plantar flexes the ankle, but also flexes the first metatarsophalangeal joint, provides some longitudinal stability to the entire foot. So remember, always kind of keep in mind the orientation of those axes, as we learned last time, how the direction of the foot, the multi-planar direction of the foot, and these are all multi-joint muscles. They're all moving across multiple joints, not even just two joints, but multiple joints are crossing. The flexor digitorum longus begins on the inferior surface of the posterior surface of the tibia and inserts into the distal phalanx phalanges of the toes 2 through 4. And again, it's a ankle plantar flexor, a midfoot stabilizer, and a toe flexor. And we'll come back to look at toe flexion here in a second. And then our on the medial aspect, our other plantar flexor is the tibialis posterior, which is a deep muscle, and it inserts into the navicular tubercle and then into the bases of the second, third, and fourth metatarsals, or the heads of the metatarsals. The bases of the metatarsals. It's innervated by the tibial nerve. Plantar flexion, inversion of the foot, and adduction of the foot. And adduction of the foot is bringing the toes, the foot, to the inside. It's a transverse plane motion. The Peroneals longus and the Peroneals brevis are the two muscles on the lateral aspect, or the lateral compartment, that have some support in plantar flexion. And we can see that the longus that originates on the fibular head and runs down, also attaching on the interosseous membrane, the superior 2/3 of the fibula, and it runs down to insert on the base of the first metatarsal. Now let's kind of keep an eye on this orientation where it comes across the foot, because this is going to be an important consideration in its function. And there's a nice groove across the cuboid, which kind of holds that tendon and will actually aid in as a fulcrum for the tendon. So if the cuboid ends up slightly subluxed, we may end up with a non-functioning Peroneals longus or fibularis longus tendon. We'll see that oftentimes as a problem. Peroneals brevis originates on the lateral margin of the distal 2/3 of the fibula and inserts into the styloid process or the tuberosity on the 5th metatarsal. And it is almost a much more pure sagittal plane motion. And again, in space, it's helping to plantar flex and evert a little bit. But we're going to look and see what it does from a functional perspective when we start talking about gait. We had a chance to look at the muscles that plantar flex the foot in space. And now I want to take a minute and examine the muscles that dorsiflex the foot. So this is the muscles in the anterior compartment, and first muscle is the tibialis anterior. So we can see that it wants to just pull that foot up and in a little bit, and we can identify its attachment along the base of the first and the medial cuneiform, and its proximal attachment then is along the lateral condyle of the in the shaft of the shaft of the tibia. The innervation is the deep peroneal nerve, and again, looking at its orientation, it wants to come down at a slight angle, and as such will be responsible for that midfoot inversion as well. The next one we want to take a look at is the extensor digitorum longus. The extensor digitorum longus has its origin on the lateral condyle of the tibia and the upper, 3/4 of the anterior shaft. Also attaches to the interosseous membrane. So if I slide our model all the way around here, we can see from the posterior view the interosseous membrane, which is that membrane that helps to compartmentalize the leg and dissipate forces between the fibula and the tibia, and supports. It also provides support in the throughout the tib-fib articulation. And then lastly is this extensor hallucis longus, and the extensor hallucis longus has an origin on the anterior surface of the fibula and part of the interosseous membrane, and its distal attachment is into the distal phalanx of the hallux, the first toe. So it's going to help dorsiflex and also extend the toe, and we'll kind of look at toe extension here in a minute. But one of the structures that I want to point out to you guys is these retinaculum. So the inferior peroneal retinaculum, the inferior extensor retinaculum, the superior peroneal retinaculum, and the superior extensor retinaculum. And what these retinacula do is help to pull down and stabilize these extensor tendons. So you could imagine if there wasn't these bands of connective tissue holding down the tendons, that every time the muscle contracted and started to pull these tendons up to dorsiflex the foot, the tendons would literally just pull away from the bone, and they would lose all of their mechanical advantage for that dorsiflexion. So these extensor and peroneal retinacula are critically important to maintain an appropriate pull for dorsiflexion and keep the tendons in their appropriate position. I want to spend a minute and just review the other two motions that are occurring in the ankle joint, and those would be the direction of again, we're talking about in space, and that would be the direction of eversion, which occurs with the action of the Peroneus longus and the Peroneus brevis. And again, sometimes these will be referred to as the fibularis longus and the fibularis brevis, with their tendons moving along and acting as around a pulley on the lateral malleolus, inserting on the styloid process, and on the with the longus inserting distally on to the base of the first ray and the first cuneiform. The other motion that we want to look at is inversion. And inversion is a function of really those three tendons coming down, and the flexor digitorum, the flexor hallucis, and the tibialis posterior. So those are the three muscles responsible for that movement towards the inside. And again, super important to keep this in mind. This is what it looks like in space, and functionally these muscles have a very different action. We're going to talk about what their function is when we start talking more about gait. But it's important to get a good grasp of the line of force and the direction of the movement, and keeping in mind what the axis of rotation is for these multiplanar joints. So let's take a look at the intrinsic muscles that are in the feet. And by intrinsic muscles, I am really referring to those that have an origin and an insertion below the ankle joint. So the first muscle that I want to take a look at is the extensor digitorum brevis. And the extensor digitorum brevis has an attachment on the lateral surface of the calcaneus, and then inserts into the second, third, and fourth digits, innervated by the deep peroneal nerve, and it is responsible for extension of the second, third, and fourth toe. I also have an extensor hallucis brevis, which attaches on the dorsal portion of the calcaneus and inserts then into the proximal phalanx of the great toe, and it's responsible for extension of the great toe, and also innervated by the deep peroneal. We can look at the intrinsic muscles in the plantar surface of the foot in terms of the layers in which they reside, and the first layer of the plantar group is the abductor digiti minimi, and so this is a little tiny muscle that attaches from the calcaneus. It inserts on the lateral aspect of the fifth toe, responsible for abduction of the pinky toe, that fifth toe. So you kind of ask yourself, what's the significance of this muscle? And every muscle in our body has some significance. There's no question. But one of the things that I see clinically with this muscle is oftentimes people will come in with a complaint of heel pain that's diagnosed as plantar fasciitis, and we'll talk about the plantar fascia here in a little bit. But the nerve that goes to this muscle, which is called the nerve to abductor digiti quinti or abductor digiti minimi, innervates the sensory portion of the calcaneus. And so if I have a impingement in the nerve where it courses down medially inferior to the medial malleolus, I may have symptoms that mimic plantar fasciitis. But when I have somebody attempt to abduct their toe and they have no function in this muscle because it does provide the motor function to this muscle, I start to think, oh, okay, maybe it's not just a plantar fasciitis, and I can start teasing out, is it soft tissue or is it more of a nerve impingement? The flexor digitorum brevis attaches from the calcaneus and inserts on the plantar surface of the toes 2 through 5, responsible for toe flexion, and assists, helps the the flexor digitorum longus. And the abductor hallucis. So this is the muscle that is responsible for pulling your big toe towards your primary midline, which when we talk about the foot, this is actually abduction. Even though it's going towards the body's midline, when we look at the foot, we draw a line down the middle of the foot, so right through the third metatarsal and phalanx. Anything away from that is abduction. Anything toward it is adduction. So that's a significant difference in how we describe motion in the toes relative to abduction and adduction. So when we look at the second layer, I have the quadratus plantae and the lumbricals. Okay, lumbricals are kind of interesting in that they attach from tendons to tendons, so they help align the appropriate tendons in the as they traverse down and attach to the toes. So in the third layer, I have the adductor hallucis, which actually has two heads. So this is the oblique head, and I have a transverse head. So these are both adductors of the great toe. I have a flexor digiti minimi brevis, okay, responsible for flexion of the fifth toe. I have a flexor hallucis brevis, assisting in the flexion of the big toe, and lastly, a small opponens muscle, which is responsible for pulling the fifth ray on that oblique axis in down and in. And then lastly, in the fourth layer, I have the interossei, which include the dorsal and the plantar interossei. So plantar interossei and the dorsal interossei, responsible for AB and the adduction of the toes, and with attachments into the tendons that that also help to align. So those are the muscles that are responsible for motions at the foot. And again, we're going to look at functional motion as opposed to action as we start looking and exploring toward gait and normal movement patterns. We'll talk in our next module about the arch and the dynamic and the static stabilizing structures that make up the arch. So until then, let's get a good grasp of what these muscles are doing and what the motions around each joint
what's occurring around each of these joints, so that we have a good understanding of the ground reaction forces which cause the motion and how the muscles will control that motion during function.